Hi, I'm Scott Berkman. I'm a pediatric urologist with St. Francis Children's Hospital. So pediatric urology involves trouble with the urinary tract and genital tract. Some of the issues that the parents will be confronted with that they see pediatricians for would be recurrent urinary tract infections. And our goal will be to prevent renal damage and to prevent morbidity of recurrent infections. Blood in the urine would clue them in to come in for a pediatric evaluation. Sometimes we meet them in the emergency room, so if they have acute onset of abdominal pain, then we find a urinary stone somewhere in the urinary tract, then I'll meet them in that case. So we like to prevent future trouble in the urinary tract. So some kids have recurrent urinary tract infections, and so we'd like to find any kind of anatomic abnormalities that could predispose to urinary tract infections. And so our goals are to keep them happy and healthy. And so preventing infections and preventing any kind of renal damage would be our goals. A lot of times we can manage that with conservative measures, medications, and different maneuvers to help them empty their bladders. If they require surgical intervention, then we're prepared to do that as well. I would say the majority of the kids are seen in the clinic setting, a few of them in the emergency setting when they're in pain or having some kind of trauma event. In the clinic setting, it's mostly to evaluate something that the pediatrician has talked to them about that's been going on for a short period of time or even a long period of time, and they've had other specialists involved and they haven't come up with an answer, and then they find it's a urologic reason. So the common misconception is that kids don't need to see urologists. Many people think they only need them in their later life, but we need to see the kids when they're born. Sometimes they have anatomic abnormalities that we'll need to address. And so I'll see boys and girls from birth on, and we need to see them to prevent renal damage and morbidity of urinary tract infections. And so we're basically here to help all the kids up until about age 21. So I'm super happy to have your kids come in. We're really happy to have you come to St. Francis.